As two practicing physician assistants, we've seen a lot and we've heard a lot. We know that you've heard a lot too. We are here to help you navigate through the BS by having open and honest conversations with other practicing professionals. I'm Heidi.
And I'm Cassie, and welcome to Mindfully Woman.
Welcome back, everybody, to Mindfully Woman. We have an awesome guest today. Her name is Hali Householder. She is a licensed dental hygienist, and she also practices as an Orofacial Myofunctional Therapist, which is a mouthful, so hopefully I said that right. But welcome to the show, Hali.
Hi, thank you so much for having me. And yes, you did say that right.
Good. I'm glad. But I know that, we're aware that you practice as a dental hygienist, which has led you to being an OMT, just for short, to keep it easy for people. But we're going to focus a lot today on OMT and what that is. And so can we just start off the bat by you telling us, what is OMT and what does that mean for you as a practice?
Yes. So Orofacial Myofunctional Therapy is the myo comes from the Greek word muscle, and it's like physical therapy for the tongue and facial muscles. So I do therapy, this individualized programs of neuromuscular exercises used to retrain the orofacial muscles and to teach them how to function properly. So I correct oral habits and help restore correct oral resting posture is what orofacial myofunctional therapy is. And I will treat disorders of the face, the mouth, and the neck muscles. And so I tell people I work with clients who have sleep apnea and snoring concerns, mouth breathers, speech problems, digestive concerns, TMJ troubles, dental crowding due to tongue ties, and incorrect swallowing patterns.
That's a lot of different things, which is awesome.
It is. It ties that in a lot of things.
How would somebody know that they needed to come and see you? Would that be something you evaluate when you are seeing them as a dental hygienist and it transfers into an OMT practice? Or do you get a lot of referrals based on somebody having sleep apnea or TMJ or a different diagnosis of some kind?
So both. I do some airway screenings and airway health screenings, and when I practice as a dental hygienist. But more so recently, I've had a lot of dentists that will refer to me, orthodontists will refer to me. I've had some speech language pathologists. So there are a lot of times they're screened somewhere else, and the provider will find that they have an orofacial myofunctional disorder. And so due to that disorder, then they bring me into the picture. And then I evaluate what types of disorders they have and how I can fix the function for them.
What is one of the most common dysfunctions that you see?
Mouth breathing is a big one.
Okay.
As an orofacial myofunctional therapist, I have four main goals of my therapy programs, and that is mouth breathing. And we learn to exclusively nasal breathe. We learn correct tongue posture, correct mouth posture, and correct and normalized swallowing. And so when they have a dysfunction, and sometimes it's like a toxic oral habit, someone's a nail biter, they are chewing on their lips. A lot of kids will chew on blankets and things.
Yeah.
And so sometimes it's to change that habit and recreate those neuromuscular connections so they're not doing that any longer.
Mm-hmm.
So if I was just a mouth breather walking around in life, could I just seek you out and say, hey, can you evaluate me and see what things are looking like in my mouth and anatomy?
You could, yeah, because recently I've had more people saying that they're finding me from Google searches.
Oh.
And so they'll Google it because now with the world of social media, we're finding out how bad mouth breathing really is for someone. And from a dentistry side of it, I'll have dentists or a lot of pediatric dentists are starting to refer to me because the kids are having more cavities, but also it can lead to periodontal disease. We can see a lot more inflammation of the gum tissue. And so those are things that dry mouth is really common, but being a mouth breather can also cause that dry mouth, and it can cause some craniofacial development issues and teeth crowding. And if we're nasal breathing, that air that we breathe in through the nose, it is going to mix with nitric oxide. It warms and humidifies. So It's better for mental health. It helps with the uptakes of oxygen. It helps with sleeping, all kinds of benefits to be breathing through the nose. Whereas if we're breathing through the mouth, we're not getting any of that nitric oxide uptake. And on a cellular level, you're actually getting under oxygenated. And so, and it has poor sleep quality, sorry, and bad posture can be led with mouth breathing too, when your mouth is really open all day. So lots of issues that can be caused by that.
Does that like then, is that because it like goes into like the neck and then like hunching shoulders? Is that kind of like why like people kind of drag?
I do see the hunching shoulders too, especially in some of my older clientele. And sometimes I'll have people, they'll think that maybe it's like a bone problem or something. But what we start to see sometimes is a lot of people, when they can't breathe properly, they're almost leaning forward because they're trying to open up that airway further. And so it's causing a lot of spinal issues. For every inch forward that the head posture is, it can essentially put 10 additional pounds on your spine. So that's a lot of extra weight, and it's carrying, and it's putting a lot of pain and pressure back there.
That is a lot. Huh. What's like, do you know like what the, like, let's say for example, as an adult, what's the root cause of people being mouth breathers? Is it anatomy? Is it just kind of like the way things have developed from a kid to the time that they are like a young adult, or what? Why is that the case?
It can be developmental troubles. It can be a high narrow palate. Sometimes there's a tongue tie involved, and so they're not able to have the tongue on the roof of their mouth. And I tell people, correct tongue posture is tongue on the roof of the mouth. And when it's sealed there, then you physically can't breathe through your mouth. You have to be breathing through your nose. But a lot of people don't know that. And so they've never been taught that, and they don't know what can happen when you're not breathing like that. But and the other thing, I'm sorry, and tell me again what else you had asked. I think that was the 2-part question.
Oh, I don't even know. That sounded good.
Okay. Answered it to me.
You answered it. Yeah. Yeah. I was just curious about like the anatomy of it, which you answered. Like,
yeah, that's what I was working
tongue tie
through.
And I was actually, as you said it, I was like putting my tongue on the roof of my mouth. Like, do I do that?
Congestion causes it too. And from a dentistry standpoint, I realized a lot of times when someone has bleeding gums and a lot of inflammation in the front of their mouth, they tend to be mouth breathers, and those same patients tend to have congestion all the time. And so when they're constantly congested and nasal drip, it's causing them to breathe more through the mouth, because I call it a vicious cycle. The mouth breathing, it disrupts your CO2 levels, and then the body alerts the brain to release more goblet cells, and those goblet cells in the nose, they start to secrete more mucus. And so it's a vicious cycle, because when the mucus is coming more, now we're forced to breathe through the mouth because they can't breathe through their nose. So that's a big one.
So people who struggle with probably allergies a lot, like struggle with that a lot too.
Yeah, I see that too. Yep. I have a lot of people, all of my clients, when we start therapy, I have them nasal clear every night once we start.
What does that mean?
Whether they think they need it or not.
Like
nasal
neti
clear
pot?
means to clear the nasal passages. Neti pot is a very great way. For my clients who can't do them, I typically have them use like an X-Clear or a saline solution to do that. But I always say, if you can use the neti pot, that's the most holistic way and natural way to do it. But a lot of people tell me they feel like they're drowning when they use it. So there's alternatives.
I love the neti pot. I use it in the shower.
I've never used one before.
Really?
Yeah, I don't know.
Amazing.
Something about, I don't know.
Yeah.
It just feels
in the water. And they have some really fancy systems now that it'll warm the water for you, and you put both nostrils in, and it circulates. And it looks pretty intense. I haven't tried it yet.
Yeah.
I mean, it looks nice.
I don't think I could do that.
I'm just thinking of the stuff coming out of there. Like, that's why in my head I'm like,
so nice when you have a cold.
We'll see. Maybe next time I'll try it. I'm gonna have her watch.
Hard pass. Anywho, you mentioned the teeth crowding. So is that because you can't like properly fully rest your tongue on the roof of your mouth? Or what?
Because they say that the tongue is like a natural expander
of
the palate, of the roof of the mouth. And so if we're expanding the upper jaw appropriately, then the lower is going to tend to follow. But if you have low tongue posture, and your mouth is hanging open, then we're going to start to see the teeth start to fall in. A lot of times we'll see what we call tongue scalloping on the tongue on the sides. And so it's scalloped in the way it looks on those lateral borders. And so that's always a sign to me that somebody has low tongue posture, because those teeth are imprinting on that tongue like that.
Oh.
So that tells me that their tongue is not up where it should be. And so a lot of times then we'll see a lot more of the crowding, because we'll see the high narrow palate and it just doesn't have the room for all the teeth to come in where they need to.
Interesting.
Which in turn is going to make the airway smaller. So small mouth, small airway.
Yeah. So then if you do have somebody with the crowding and the narrow palate, is that whenever you get like orthodontics involved to do expansion, or where do you go from there?
Depending on the age,
Okay.
if it's a child, then yes, we get expanders. We get someone to do, nowadays they do a lot of early child expansion. We don't really wait for all the permanent teeth to come in anymore. If someone is high narrow palated and we see that we need to intervene, I refer them. I tell my patients I am a small piece to a big puzzle. And so this is where I start doing the referrals to someone who that's their specialty. So we look into orthodontists or orthotropists. Orthotropist is more so going to be looking at focusing heavily on expansion, so all the teeth come into place where they need to, not so much aligning the teeth. Whereas orthodontics, if you go to a traditional orthodontist, you want to make sure that you're going to see somebody who knows the value of expansion and talks about breathing disorders and airway health, because it's really important to make sure that you expand everything properly enough to get that.
Yeah.
What's an expander? Like, is that the external device?
Well, there's some that are external, but there's some that are internal.
Okay.
And the internal ones, so for a lot of kids, if you're doing early expansion, they have a fixed one that they can cement in there, but they also have the removable.
Okay.
And especially when a child doesn't have the permanent teeth back there, a lot of times we're going to see that they're removable. You take them in and out. They need to be wearing them all the time though, except for when they're eating.
Okay.
And there's different appliances. So different providers are going to provide a different appliance, and they'll tell you how to use them and everything. But there are options. And for adults, there is adult expansion where sometimes it's surgical. And then there are some newer concepts out there now that they are giving them removable appliances to expand as an adult. So, and that's a little bit more new to a lot of people. But it's neat. It's because a lot of people will say it can't be done, and it's not a quick process for an adult.
Yeah.
It takes time. And I mean, some people work on this for 3-4 years in that process as an adult. So it's certainly easier to fix as a child.
Wow.
But it is doable. If we can, and sometimes it's a matter of changing the bite, those cranial sutures there. If we can give like a HomeoBlock appliance or a HomeoBlock Plus, something just to slightly shift all those plates, then that's going to bring relief to certain effects too that some people have.
Interesting. That sounds painful.
That does sound painful.
Yeah.
But it is interesting. It's so cool.
Yeah, absolutely.
Is there ever an age, and this is strictly your own opinion, that you think is too old? Like, is there ever a time when you're like, oh, like, this is probably not worth it for you?
No, and well, depending on, the expansion, because the expansion isn't always necessary. A tongue tie release isn't always necessary. Sometimes it's just a matter of building the muscle. I focus on the root cause resolution. So I want to get to the root cause of what the problem that they're having. And sometimes it's just building those muscles of the face and the neck and the tongue to be able to hold them in the proper position. Because sometimes it's not an actual restriction. Those muscles are weak. My oldest client is 67. And I'll tell you, I see a lot of elderly patients that when they don't have that muscle built there anymore, they worry about things like swallowing and choking on their food.
Yeah.
And so sometimes it's a matter of building those muscles for them so they can swallow properly and so they don't choke.
So do you get a lot of referrals from like speech therapists or vice versa, I guess?
I've had some, and I also refer to speech therapy
I
quite
was
a
just
bit.
Okay.
gonna ask
And
that. Yeah.
I've had some clients come to me who have been in speech therapy for 3 or 4 years, and
Oh.
they haven't gotten the results that what they've been looking for. But a lot of
Mm-hmm.
times, and a lot of speech therapists now, they are starting to become trained in OMT, which is awesome.
Yeah.
But some of them, we find that they're just listening for the right sound. And they're not all trained to get in there and really look exactly where's the tongue touching or what could be holding the tongue back. And
Okay.
some of them have just never been trained on tongue ties and things like that. I mean,
Mm-hmm.
I'm a hygienist, and I that wasn't a big part of my schooling either.
Mm-hmm.
And so I've had to go back for additional training, and a lot of them are doing the same. But
Okay.
when I can get in there, then we work together that we remove that physical restriction. I help build the muscle, and then they
Mm-hmm.
have better outcomes. And
Okay.
so we work together in those situations.
And I feel like there's a whole population there too with speech pathologists where they can focus on the older individuals, because a lot of the times, like, I mean, I know they work with younger individuals too, but like I'm thinking about people who've had, strokes or even like minor TIAs or transient ischemic attacks, which is a mini stroke, like just helping them like function better and truly evaluating their anatomy too. I feel like that's a whole span of people that might be missed initially. So I think that's great that they're learning how to do that too.
Yeah.
Yep. And I bring a physical therapist involved, occupational therapist sometimes. It's
Interesting.
like I said, a small piece to a big puzzle, but we work together to get root cause outcomes and resolutions.
Oh, that's great. And it definitely takes a team effort with something that important, So you mentioned tongue ties. Can you explain what the heck a tongue tie is? How can somebody look
Sure.
in their mouth and see if they have one? And then
Sure.
what are the issues with it outside of issues with breastfeeding? Because I feel like you always hear about it with your newborn baby not latching, things like that.
Yep. And that's where a lot of times it's caught in the first place in
Mm-hmm.
infancy. And I always refer those infants to an IBCLC for lactation consultants and things to look at those heavier. But what a tongue tie is it's a prenatal attachment. It's under the tongue, and it is that small piece of tissue that connects the bottom of the tongue to the floor of the mouth. And some of them are shorter, some of them are longer, some of them are tight. Some of them are tight enough where I have clients that come to me who can't lick an ice cream cone. But over time, the body just kind of compensates. And for a lot of people, it doesn't become a problem until they're much older. But if we don't catch it, it can start to cause jaw problems. It can cause the teeth to be crowded, the high narrow palate, because the tongue doesn't rest on the roof of the mouth where it naturally should. We turn into mouth breathers. We're all born nasal breathers. So when you're a mouth breather, it's a learned habit over time. And so usually something else is causing that. Yeah. And so, and I see a lot of digestive issues because if someone's not swallowing correctly, they swallow additional air that's getting back there. And so that causes a lot of problems with the digestive system. It can lead to anxiety and depression. It can lead to sleep disordered breathing is a huge one. If you're snoring a lot of times, that short attachment, when you lay back, the tongue falls into the throat and it causes the body to push your lower jaw forward. And a grinding and clenching is an attempt to kind of open up that airway space. So in dentistry, I'll see a lot of teeth that have been flattened, especially in the front. And when I see that, that's the first thing I ask is, have you ever been told that you snore? And if so, then I start asking questions about, how are you feeling rested when you wake up? I've had some patients that they sleep 11, 12 hours, but they feel exhausted.
Oh man.
And it's because the quality of sleep is terrible. They're not actually sleeping. They're being woke up from all those different REM cycles. And so a lot of them, I will send them for a sleep study.
Yeah.
And it'll come back and then we go from there, because a lot of times I've had people reach out to me solely because of sleeping and snoring. Their partner has said they're snoring. They don't want to wear a CPAP. And so they have sleep apnea and they want to know what else they can do. And so orofacial myofunctional therapy has been shown to lower the AHI and to help with sleep apnea. And so I tell people I never promise you that we're going to get you off of CPAP, but we do work towards that. And
Wow.
sometimes we can, sometimes we can't. But
Mm-hmm.
if we can give you something else, and then also sometimes we make a dental appliance that can push that lower jaw forward just slightly to open up the airway too. So that eliminates clenching and grinding and breaking teeth for a lot of people, because I have a lot of adults that will come to me for cracked and broken teeth because they're going at it when they're sleeping every night.
Yeah.
That's amazing. That's a lot. Oh my gosh. I'm just thinking of all the different things that it can affect and do.
Yeah. I'm just actively trying not to mouth breathe.
Yeah, me too. Yes.
So put your tongue on the roof of your mouth and have it sectioned up there.
I'm like,
I know. Also trying to figure out if I have a tongue tie. I'm like moving my tongue around. I'm like, I think I can lick an ice cream cone, so I think I'm good.
I definitely can lick an ice cream cone.
There's all different levels of it. And just because somebody has a tongue tie or that short attachment, it doesn't always mean that there needs to be intervention. And so they need to have a comprehensive exam, a functional exam, to see how it affects the function of the tongue and the face. Okay. And if it's not affecting the function, then a lot of times they don't have to do anything about it. But a lot of times they do. And so, if they're having trouble with chewing, if their jaws are hurting, if they have a lot of neck and upper back tension and shoulder tension that they're carrying, if their severe headaches is another big one for a lot of my tongue tie clients. The ringing of the ears is another one. A lot of those things. Bedwetting for older children. That's a big one too. Ear infections, a lot of ear infections because of the way that they're swallowing. They're not able to swallow correctly because the tongue is restricted. And so that has to do with a lot of the tongue ties too.
How's a bedwetting mix in there? Heck? Do you know anything about bedwetting?
It's the way that the body relaxes. And so when you're in the right sleep cycles, then you're not in the fight or flight mode. But tongue ties are connected a lot to the parasympathetic nervous system as well. And so and that's where digestion comes into a role too, because I tell people if your body is in fight or flight, you're not worried about processing that taco when you're trying to fight off a saber-toothed tiger. And so your body is not thinking about what it should be doing. It's more so worried about everything else going on. So we work on that too, about relaxing and breathing properly, breathing from the diaphragm and not breathing from up here.
Yeah.
That's a shallow thoracic breathing is what I call that. So that throws your body right into fight or flight. So that's part of my program too.
I know when babies are young, they can clip that spot to release that. Do they ever do that when people are older, or is that solely?
Oh, yes.
Okay.
Yep. I work at 2 different offices right now that both of those providers do it. And then I have a referral source for all over the US of people who have been trained to do that. I tell people you don't want to just go to someone who's just going to try it out and see. You want to go to someone to a provider. It's usually going to be a dentist or a periodontist. Okay. ENTs will do it. Okay. But you want to go to someone who's been trained specifically for that, because there's lip ties and buccal ties, are what we call them, that are not under the tongue. And those are a little bit easier to be released. But if someone is releasing that attachment under the tongue, there's a lot of things in there that could go wrong. And so you want to make sure that they know what they're doing. And as an infant, orofacial myofunctional therapy isn't needed, but it is needed to be stretched. And so the provider who does that, they'll show the parents how to get in there and break open that wound and keep it stretched. Because if you don't, for both infant, child, adult, anyone, it can come back together and it can reattach, and it creates scar tissue. So then you're going to have a bigger problem than when you started. But as a child or an adult, the way to do all those stretches is going to be orofacial myofunctional therapy, and we're going to relearn how to use those muscles and rebuild those connections now.
Wow. So crazy.
It's pretty neat.
That really is.
You can do it with a laser. There's some pretty cool lasers out on the market now. The procedure is a lot easier. They'll use the laser to open it up and to make that cut, and the healing process is much easier. Some do still do it the older way with cutting with scalpel and all that, but
Oh, that
and
sounds horrible.
stitches are not uncommon because
Okay.
it's going to heal from the inside out,
Yeah.
which is why the healing process is going to be a little bit longer. But
Yeah.
it and so some people will come to me for revision, meaning that they've had a tongue release done in the past,
Mm-hmm.
but no one had ever told them the importance of OMT
Mm-hmm.
and keeping that from reattaching. And so it did reattach. And then they find that they're still having a lot of issues. They're still having a lot of tightness throughout the neck and shoulder and headaches.
Mm-hmm.
And I also I'll have like a craniofacial or cranial sacral therapist come in and do some massage techniques for them. So that's another one of my referral sources is for
Wow.
massage and cranial sacral therapy and things like that, just to release all that fascia and
Mm-hmm.
that connective tissue because it's been bound so tightly for so long.
Mm-hmm.
And there's been people who have reported that their feet will just kind of fall to the side when they have it done because it
Mm-hmm.
just releases everything. I had a girl in my class who I studied with, and I never would have believed this if I did not see this for myself. But she works out 3 to 4 times a week, does yoga, has never been able to fully touch her toes after she had a tongue release that she didn't know about, by the way, until our course. She's also a hygienist.
Uh-huh.
Found out that that was the reasoning for a lot of the issues that she had been having. 2 days after her tongue tie release, she was able to bend over and touch the floor. We could not believe it. It
That
gives me
is
goosebumps still,
That is
but it's
crazy.
just,
insane.
it is. And so there has been some reports of people with plantar fasciitis even
Uh-huh.
have been able to get relief from something in that area of the body by releasing a small string
Interesting.
under the tongue.
That is
It's
so
amazing.
crazy.
Wow.
That is amazing to
So
think about.
this could help with weight loss, sleeping.
From the sleeping aspect, yes.
Yeah.
Flexibility,
Flexibility.
swallowing, digestion.
Yeah.
That's why
Holy
it's so
cow.
fascinating to me
That is
because of all the
fascinating.
different aspects that it could potentially bring relief to. And
Yeah.
I think that's why I love it so much because we're always learning more. There's
Mm-hmm.
more evidence-based research that keeps coming out.
Mm-hmm.
I could spend hours researching all these things, and the books are so any book that has been written over all this stuff now, it's just so entertaining because there's so much to learn about it. So
Yeah.
many things that can help.
I never even knew such a thing existed. So I think it's
Same.
really neat that it is becoming more well known or being put out
Yeah,
there.
and you're not the only one because when I first got into this, I had a lot of dentists and physicians would look at me like, okay.
What
And
are
at
you
first I
talking
kind of
about?
felt defeated. I thought that, I mean, am I doing what's right? Is this
Right.
crazy? And I knew that it was a more of a holistic approach, which that's what I loved about it
Mm-hmm.
because I can get people off medications sometimes. But I have since then learned that now that it's becoming more popular, those same people have been reaching out to me, wanting me to come and present to their office or
Oh, very
talk to
cool.
their staff about it or talk with them about it. I've had
Mm-hmm.
pediatricians reach out saying, hey, I'm not familiar with this yet, but I'm learning. And please tell me, like, what do I need to do in this situation? And that's been really cool for me because that just shows that they didn't think I was crazy. They just
Mm-hmm.
don't know
Yeah.
what it is. They don't know what it is. They've never been educated about this part of it before,
Mm-hmm.
but they're willing to learn and they
Mm-hmm.
want to learn. And there's programs out there for people who are wanting to. I've had so many hygienists reach out who want to be part of this now and want to know how I did it and how I got training. And so the more people that find out, the more of the general public is going to start finding
Mm-hmm.
out.
Yeah.
And that's one of my things. If I can keep someone off going on 3 or 4 different new medications because we can fix a root cause
Yeah.
problem, then that's my goal.
I'm all
And
about
to see that
Absolutely.
actually unfolding and working, it motivates me even more to
I
continue with
don't.
it.
Yeah, I don't doubt that. I feel like there's so much more of a push too, to figure out like the root cause of
cause
something,
medicine.
or like more of the doing something more natural versus just taking
Yeah.
more and more
Medications.
medications.
Avoiding the
Yeah.
big pharma, so to speak,
Yeah.
anymore, which is
Yeah.
good. I mean, you got to figure out like why are things happening, which
Right.
you're on the front
Yeah.
lines of that. What does it take to do that? So you were talking about, talking to different dental hygienists about it. What does the certification process look like?
So I did a 40-week program. I have to hold my dental hygiene license in the
Okay.
state of Indiana to be able to practice that here.
Okay.
And so I did that course first, and I'm in the middle of getting my certification from the International Association of Orofacial Myology. You don't legally have to have that to practice because we don't have a governing board per se for orofacial myofunctional therapy.
Mm-hmm.
But some states are starting to put more regulations into place for it. And so just for peace of mind for me, I actually just took my written boards the other day and I passed.
Yay!
So I'm so excited about that.
That's awesome.
And now, yes, thank you. And now there's going to be, I'll have there's a part 2 of it where I'll have to have a live patient and at different stages that they'll have to watch me do and check me off on all that. And I don't necessarily think that just because having it that would change from an OMT to a COM, a certified orofacial myologist.
Okay.
And sometimes they call them orofacial myologists. There's all different names for what we all do, but you can't use the COM behind the name without having that actual certification. And I don't think there's plenty of powerhouse providers that are OMTs that do phenomenal jobs. But for me, it was just something that I want to just prove to myself that I can. And the more I like to constantly learn.
Yeah.
So if I can I will always and forever take more courses and continuing education courses. And I always think I'm just going to be a lifetime college student. or just learning more all the time.
Nothing wrong with that.
That is great.
No,
yeah.
There's so much in this field. So that's next for me. And eventually it could be a part of the process for someone to practice that in Indiana, but right now it's not.
Okay.
And then if you want to open your own business with it, that's a whole separate thing. Unfortunately, a lot of insurance companies are not covering it right now, but I have had some. I provide a super bill to my clients and I encourage them to submit it to their insurance. And we have had some get reimbursement, which is fantastic. That makes me excited. And then people will use FSA and HSA too with me, and I'll provide them a receipt. So that has been working as well.
Okay.
So then can you tell our audience, do you have your own private practice for this or how does your practice work?
I do. I opened 2 years ago. It's called Indie Myo, and I have my website is indiemyo.com, so you can find me there. But I do virtual myofunctional therapy, but I also do in person. And I actually, when I first started, it was all virtual, but now that I've been doing in person, I really prefer to do the new patient exams, the comprehensive functional exams in person, because I take a lot of measurements. I see how the tongue and the facial muscles function. I take a lot of photos, and it's a lot easier for me to take those than my clients. And then once we go through that and we see what kind of program they need and what steps to take, then from that point we can go virtual. But sometimes I'll have, every other visit they'll meet with me in person. I have some, especially with some of the younger kids, that they just do a lot better in person. And so it's nice to be able to have that. I do that out of 2 different dental practices, and then sometimes I do it out of my practice where I do hygiene, but the other 2 practices I do it out of, I don't do dental hygiene out of there. I just do OMT with those, but it's been working really well. And both of those providers that I work with, they are both able to do tongue releases, so that's very helpful because then my patients already know where they're at and who they're seeing. And they trust them. They've already formed that bond. And that's really helpful.
Yeah, that's a really neat relationship then that you can have. So then you can have an actual brick and mortar office, and people can be associated and have good follow up there.
So how do you separate that from your dental hygienist job then? Do you do a few days dental hygiene and then a few days OMT?
I do.
In the office
I do
or whatever?
2 to 3 days a week right now, dental hygiene. And 1 to 2 days a week with orofacial myofunctional therapy. And ideally, as I continue to grow, I would like to do 2 days of each every week. I'm still super passionate about dental hygiene, but I am super passionate about OMT. But I really do think that they go hand in hand because of things that I see in the mouth every day, and not just wanting to, cover something up. I want to find out why. Why are we seeing this? Why is this happening to the bone structure? Why are the teeth looking like this? Why are we having problems with this gum tissue, periodontal disease, all of that? And so if I can dig deeper and not just do the hygiene side of it, it's really helpful. Airway screenings are big. Dentists, that became part of the dentist scope of practice in 2017.
Oh.
So dentists should already be looking for airway troubles and breathing problems already. That should be something that they're doing.
Oh, okay. So if your dentist isn't asking you if you snore at nighttime,
your ringer should go
or
Yeah.
red flag.
or do you find that you're a mouth breather?
Yeah.
Then
I meant to
the clenching grinding is a huge one. The clenching grinding that people are breaking teeth, they wear their teeth way down. That's one of the first indicators to me that it's possible that there is some sleep disordered breathing happening. And for a lot of people there are.
Wow.
I had a question about your programs. How often do you normally see people for? Like, do you do like 6 months, a year, or does it depend on the person?
It depends on the person, but I offer a 6 month for an adult. I offer a 1 year for an adult. Typically the ones with 1 years, they use all their ink when they're filling out my paperwork. And so I know right off the bat that this is probably going to be a year comprehensive program. For many of them that come to me, I'm kind of like their last Hail Mary. They've spent
that's what it was
thousands of dollars seeing specialists all over and have not been able to come to conclusions. But others that now they hear about this profession a little earlier, and we've been able to save them a lot of money to not have to go to a lot of different specialists already. But I also offer a mini myo program, and most of my mini myo programs I allow a year for because we're in the middle of development, and sometimes when we undergo expansion, we put our therapy on pause. Depending on the provider, if the person doing the expansion wants them to wait and do more myofunctional therapy and a tongue release after, some want it before. So I work with providers either way. I respect their judgment on how they feel for that client, if they want to do myofunctional therapy during, before, or after. So I do it all.
That's amazing.
Yeah.
We talked to, sorry, you go.
I was just going to ask, so it's therapy. So is that meaning it's a lot of like stretching and like exercises then? Sort of like
it is.
PT, I guess, PTOT.
Yeah, we do a lot of exercises. We do a lot of muscle building.
Okay.
And I give people some massage techniques. I teach them some hands-on stretches too, just to help them, especially if they've had that tongue released. Then I want them physically putting their hands in there and breaking open that wound and stretching it how they should. But I also give them stretches to do. And so we do a lot of learning how to dissociate the tongue from the jaw, because a lot of my jaw clients, they overuse their jaw without realizing it. But if they have that restriction, every time they swallow, every time they speak, if they stick their tongue out from side to side, sometimes you'll notice the entire jaw is being drugged with everything that they're doing. Or if they're just clicking their tongue in their mouth, the jaw goes up and down like this. And we learn to stabilize that and to use them separately so they're not overusing those joints.
Okay. Wow.
And we touched a hair on ages. What's the youngest you'd see? What's the youngest age you see?
4 is when I will start. And not always. They have to be cooperative and they have to be compliant.
Okay.
And I tell parents, as much as I love the kiddos, if they're not going to listen to me and if they're not going to do these exercises, then it's a waste of money and they're just not ready yet. And it's a waste of everyone's time, because the parents have to be very involved on this too. Just like a physical therapy, I can give you those stretches and I can give you all the supplies, but if you're not doing them at home, then we're not going to achieve our goals with this program. And so everybody has to be on board with it at those younger ages.
Mm-hmm.
Yeah.
For sure.
They're cute but feral.
Feral.
Yeah.
Like a cat.
Yes. And I try to make it fun. I send fun little kits with all kinds of fun
Aw,
kids
yeah.
stuff and balloon stuff because we strengthen the lips and we
Uh-huh.
work on breathing and we just do fun stuff. And it
Aw.
is a fun program for the kids. And
Yeah.
most of them, once they get started, they do get excited about it. But
Mm-hmm.
then
Gotta
life
be
is busy
consistent.
for everyone. People are at sports or they're going to school, and if it's not on your radar and if it's not something that you're going to make a habit, then it's not going to become a lifelong habit.
Mm-hmm.
And that's what we want, is that consistency, so they don't ever have to do it again.
Right.
Yeah,
Makes
definitely.
total sense. Yeah.
I can't wait to see where this field goes. Like she
Absolutely.
said earlier, we've just really
Either.
learned about it. And I mean, I can't wait to see what you do too. I mean, I feel like you're just kind of
It's
starting to take
exciting.
off too. So this will be amazing
It
and
is.
a good resource for us,
For sure.
too, to think about being,
Yes.
being in medicine and sharing that with other people we know too. And
Yeah.
hopefully listeners can take this home too and do something with
Yeah.
it, which is great. So,
Yeah.
It's gonna be good. It's been around for so long is the thing. I just think that we kind of got away from it, and then now it's becoming more of a popular thing. And
Mm-hmm.
I've tried to build up my social media side just so I can put some of the information out there for
Yeah.
people to
Mm-hmm.
say, oh, well, what is this? And then the more traction I get, the more of the general public becomes involved with it. And so it's gonna be good.
good.
It's gonna be
Oh,
good.
that's very cool. And so you mentioned that, so you have your website, Indy Mayo. Is that also your Instagram handle as well?
At Indy_Mayo.
Okay.
Okay. We'll
Like
add
my
that to
Instagram.
our show notes so people can click on it
Okay.
easily.
Yeah.
Oh,
Okay,
is there
thank you.
any last
I try to
pe-
put free information on there.
Yeah,
So
yeah.
Perfect.
but I put information for both dentistry side, hygiene side, and
Okay.
orofacial myofacial therapy. And I do a lot of like sleep promotion stuff. So I get a lot of those from chapter books. That's what I like to do in my spare time, is learn more about the health. So
Perfect.
I try to take a lot of that information that
Yeah.
I read from some of these books that have been written and put those into Canva and create fun content for people just to get some free
Oh.
information.
Love it. We love Canva.
Love the Canva.
Is there
Me
any
too.
last piece of advice that you want to give people out there, or anything you kind of want to drive home before we end the episode?
I would just say, don't be afraid to jump into something like orofacial myofunctional therapy or root cause resolution for your health. It's overwhelming to a lot of people, and
Mhm.
the journey for myofunctional therapy, a lot of people get hung up on that because they don't know where to start. They don't know, should I go to an ENT first? Do I need to see an orthodontist, or do I need expansion? They just get so overwhelmed that I see people will shut down. And so I say that's part of what I do. I'm your guide for the journey. So don't hesitate to reach out if you need help or have any questions. I'm available, and I love to talk all things Myo. So I'm
Love
here
it.
for it.
Yeah, that was perfect.
That was perfect. I loved it.
Yeah.
We appreciate you
Thank
so
you.
much being here with us, and
Thank
hopefully
you so much.
we get to talk again soon.
Yeah.
Oh, we will. Thank you guys for having me on. It was great.
Yes.
Yeah.
We'll
Take care.
See ya. Bye. The information that you hear on this podcast is not a substitute for medical advice. As always, please seek out personal care and advice from your medical team.